The meaning of tests that evaluate kidney function. Specifically, evaluate kidney function through blood tests, urine or diagnostic imaging tests. In particular, in order to most accurately assess kidney activity, patients will have to perform and combine multiple tests. Blood biochemical tests evaluate kidney function. 1. Blood urea test evaluate kidney function. Urea is a degenerate product of protein. Kidneys filter urea through glomeruli and excreted from the body through urine. Urea blood test helps evaluate kidney function and monitor kidney disease. Normal renal function index when blood urea values fluctuate between 2.5 to 7.5 mmol/L. Urea blood increased in the case of diseases such as glomerulonephritis, tubular inflammation, kidney stones, kidney failure, ureteral stones, dehydration due to high fever, diarrhea, congestive heart failure. Urea blood decreases when patients eat less protein, impaired liver function, transmit more fluids. 2. Serum creatinine test evaluate kidney function. Creatinine is a product of creatine degradation in muscles, excreted by the kidneys. The creatinine index in the blood helps evaluate kidney function. Normal creatinine values for men are 0.6 to 1.2 mg per deciliter and women are 0.5 to 1.1 mg per deciliter. When creatinine levels rise, it means that there is renal dysfunction. This is because when kidney function is impaired, the ability of creatinine to filter decreases. From that, leading to higher levels of this substance in the blood. For example, the creatinine index in renal failure increases with each level of renal failure. Creatinine index below 130 mmol/L, stage 1 renal failure. 130 to 299 mmol/L, stage 2 renal failure. 300 to 499 mmol/L, stage IIIA renal failure. 500 to 899 mmol/L, stage IIIB renal failure. Above 900 mmol/L, stage 4 renal failure. 3. Electrolyte test evaluate kidney function. Renal dysfunction causes an imbalance of electrolytes in the body. Specifically, sodium, natrium. Blood sodium in normal humans ranges between 135 to 145 mmol/L. Meanwhile, in people with renal insufficiency, hyponatremia may be due to sodium loss through the skin, kidneys, digestive tract or excess water. Potassium. Potassium in normal humans is 3.5 to 4.5 mmol/L. Meanwhile, patients with renal insufficiency often have hyperkalemia because of the impaired renal excretion of potassium. Blood calcium. Blood calcium in healthy people is 2.2 to 2.6 mmol/L. Meanwhile, renal failure causes hypocalcemia accompanied by increased phosphate. 4. Testing for acid-alkaline balance disorder evaluate kidney function. This is a kidney function test usually required by a doctor who suspects kidney disease. Typically, blood pH is maintained at 7.37 to 7.43 to ensure optimal functioning of cellular enzymes, coagulation factors and muscle contraction proteins. Meanwhile, renal failure reduces acid excretion during metabolism or causes loss of bicarbonate. At the same time, increases the concentration of acid in the blood and organs in the body. 5. Blood uric acid test evaluate kidney function. This is the test used to diagnose gout, kidney disease. Normal uric acid concentration in the blood of men is 180 to 420 mmol/L, women are 150 to 360 mmol/L. In particular, blood uric acid increases in people with kidney failure, gout, psoriasis. 6. Some other tests. Serum albumin. Normally, serum albumin index is 35 to 50 grams per liter, accounting for 50 to 60% of total protein. Meanwhile, albumin is sharply reduced in people with acute glomerulonephritis such as acute glomerulonephritis. Plasma total protein. This is an indicator that reflects the glomerular filtration function. Normal blood protein level is at 60 to 80 grams per liter. Meanwhile, people with kidney disease often have reduced total protein due to damaged glomerular membranes. Total blood cell analysis. People with a reduced number of red blood cells often have chronic kidney failure. Urine test, evaluate kidney function. 1. General analysis of urine, evaluate kidney function. Density of urine. The proportion of normal urine is 1.01 to 1.020. Meanwhile, early renal impairment may reduce urine concentration, resulting in a decreased urine density. In case of suspected kidney disease, the patient may be ordered to perform more tests. For example, the urine concentration test, the dilution test for urine, comparing the density of urine day and night. The protein. The protein urine analysis sample assists the doctor in appointing the patient to perform a 24-hour urine protein quantitative test. 2. Quantify proteinuria, urine protein, 24 hours. Protein in urine in healthy people is 0 to 0.2 grams, L, 24 hours. Meanwhile, in patients with glomerulonephritis, acute glomerulonephritis, renal failure, systemic diseases that affect the kidneys, diabetes, lupus erythematosus, hypertension, often suffer from increased proteinuria to above 0.3 grams, L, 24 hours. Diagnostic imaging tests, evaluate kidney function. 1. Abdominal ultrasound. Helps detect a condition of hydronephrosis due to obstruction of the ureter. Patients with bilateral hydronephrosis can cause acute or chronic renal failure. In addition, detected cases of congenital and inherited polycystic kidney disease. Imaging ultrasound shows kidneys small in size. Structural changes. Multiple follicles or loss of differentiation of the medulla. All are suggestions of chronic kidney disease. In addition, ultrasound can also help detect kidney stones or tumors in the kidney. 2. CT scan of the abdomen. A procedure that uses X-rays to examine images, allowing the doctor to clearly see the entire urinary system. In particular, abdominal CT scan is usually used only in cases of suspected renal failure due to obstruction of the urinary tract. In addition, CT scans with contrast injection using a multi-slice scanner can render the entire urinary tract. At the same time, help the doctor detect the location and cause of ureteral obstruction. 3. Radiation of kidney by radioactive isotope. It is the only test that allows evaluating each kidney's function. In particular, this method helps doctors clearly see the filtering function of each kidney, the percentage of perfusion and participate in the function of each kidney. In addition, if a diuretic injection is used, the test will help the doctor assess the degree of bilateral obstruction. Assign renal function tests, evaluate kidney function. Annual health check. In a nutshell, do simple tests that are directional, such as blood biochemical test, total urine analysis, blood count and abdominal ultrasound. Family history of hereditary kidney disease or close relative with renal impairment. Of course, blood biochemical tests, blood counts, total urine analysis, abdominal ultrasound and genetically specific tests are necessary. When there are signs of renal failure, certainly, you should perform blood biochemical tests, total urine analysis, blood counts and abdominal ultrasound. When additional causes of obstruction of the urinary system are detected, additional imaging tests should be performed. When a blockage is not found, a kidney biopsy may be performed. History of surgical interventions on the urinary tract or abdominal organs. At this point, you should do blood biochemical tests, blood counts, total urine analysis and abdominal ultrasound. When signs of obstruction of the urinary system should do more imaging tests. How to improve your kidney function naturally. Starting today. Try the kidney disease solution risk-free for 60 days. Link in description. Thank for watching. Don't forget like, share and subscribe to watch new videos. Wish you and family peace.